Let me introduce myself. My name is Julia, and today I'm gonna lead this session. And I'm also from Russia, but now I'm living and working in Hungary, in Budapest. First of all, the topic of our session today is how COVID-19 influenced the admission process, the education process, and what are the challenges we face during this period. And we've decided to choose this topic because it's very, very important. And I know that now a lot of students, future students, are worried about this question, about the question of security and how the situation will influence their education, their studying process, even accommodation. So we found it very important to discuss it with you, to ruin the myths and tell you that it's not so difficult and you can do it. And first 30 minutes we will have a discussion with our mentors, and today we have many mentors. We have mentors from Australia, Netherlands and Spain, UK, Germany, Belgium, USA, Russia, and Hungary, and China, I'm sorry. And we will ask them questions, and in the end, the second part of our session, we will let you to ask the questions. And of course, you can write it in the chat, or you can just unmute your microphone and speak with us. So as you wish. So let's do it. Let's start. And my first question will be, and first and the main one, guys, what do you think? How COVID-19 influenced the admission process? Maybe you can give your examples from your life. How was it in your situation?
All right, I would like to start. Again, my name is Sophia. I study at Munich, Germany. And as for Germany, I would assume that the COVID situation not only doesn't affect your admission process, but it only makes it easier, because now you have, for example, the opportunity to take the language test online or through computers. So you have many different opportunities now. As well as that, you now don't really have to send the documents per post in many cases. You can just submit them on the website of the university or through many different other websites that are given. And I would assume that, for example, Studienkolleg, which is like a preparation course for university, many of them canceled their exams and now only admit with the GPA results. So there is a competition based on the GPA and the average grade. So honestly, it only makes it easier, and yeah.
I actually agree, yeah. Anyone else wants to share?
In Russia as well, I don't think the COVID had affected the admission process per se, because usually in most of the technical universities, you have a written exam, and then that's it. They don't even check your language requirement or anything, and it stays the same even now. Even now the process is almost the same. There is no other extra additional requirement in medicine, or say for the admission process. It didn't change anything.
Mm-hmm. Okay, that's interesting. Anyone else who wants to tell something about it?
I think not much. First of all, I introduce myself. I'm Ashrika, and I'm studying at the University of Sydney in Australia. So I don't really think a lot has changed in Australia per se. But in terms of the admission procedure, I don't think a lot has changed, because it's quite frankly the same. But they do have more concessions for students. Like at universities, they do have concessions for commencing students, which is absolutely brilliant. And I do think that there are certain subjects that have reduced their caps. So basically, the marks that you need to get into university for a particular course, they have brought it down. But in terms of competitive exams or language efficiency tests that we have to give, I don't think much has changed in Australia.
Interesting. Okay, well, I agree with you guys, but what about the visa application process? Because, for example, I was applying in 2020, and it made this process much more difficult for me. What about your countries?
I would agree because with the COVID situation, usually they postpone like the deadline, they move it to a later date, and then you're waiting for those results. You're waiting if they checked your documents, if they're all correctly, and it all takes a very long time. And you're very nervous during all this time. But still, I think it's the perfect time right now to apply for universities.
Cool. Anyone else?
Hi.
Can I go?
Sure.
Can I go? Sorry.
You can go.
Oh, thank you. My name is Jacqueline. I'm here in USA since 2016. I'm doing my doctorate degree. So I wasn't affected during the process to the application, but I saw my friends, some of my friends is struggling with that. I believe that at least in my university, most of the application was online. But the problem was more about the documentation. So nowadays, because some countries started the vaccination, it's a little bit better, but still you have guides that the university provide to you, and they are, of course, like constantly answering your questions, or you have sectors specifically to ask questions about COVID, because you never know, the pandemic goes on and off, depends on the variant, and can affect at least some of the documentation related with visa. And I think that definitely affect a lot of students in the beginning, because the university was, most of the universities was like creating plans. And when you're in this process of creating plans, it's complicated because sometimes it takes some, the university needs some time to organize itself. But now it's much better. I believe that is the best time, like one of our mentors said, each university creates a plan, and they are trying to facilitate things, do things online. For example, here, the universities provide you vaccination, provide you, if you need, provide you some facilitation in your visa. At least with my university, they try to do that. I think that in the United States, they try to do it. So in my opinion, it's the better time before another variant appear. But now it's the best time.
In the same situation, universities are trying to support students and make it easy. Thank you, Jacqueline. Priya, you wanted to?
Yeah, I sort of agree with what Jacqueline just said. So even in the UK, I've seen my peers going through the admission process, and also my juniors, and especially from country India. So although the eligibility criteria for the admission sort of remained the same, there were no concessions given because everything has been fairly online before. But when it actually came to the admissions process, there was a high degree of confusion that existed on the university side as well, and also on the student side. So because UK's government is a bit fussy, so it keeps changing rules quite often. So some of the rules were changing quite often, especially when variants like Delta came out. It created a lot of confusion, and hence even so, for example, if hypothetically speaking, if a student is applying for an admission and the HR or like the admission sector takes care of the things, people might be isolating and might be sick over there. So there's a significant amount of delay associated from the university side and even the student side. So even if the student gets a green signal, an unconditional offer from the university, when they approach for the visa, you need to get notarized documents, and people are missing on the notary side because of COVID. And similarly, visa appointment dates weren't available. So as a result, people were either getting delayed, or they had a significant confusion of, oh, should I actually go to the country and study, or is it online? It's online anyway, so I'm better off here, but I'm actually paying international fees, which is like 4 times the regular fees. So all this sorts of confusion was associated. So I would say that the admissions process was significantly affected, although the process was straightforward.
Yeah, of course.
I sort of echo what everyone said. I'm an international students officer at my university, and especially during 2020, there were a lot of international students that approached me, and especially people who were trying to apply at the University of Sydney. Because there were higher visa waiting times. A lot of people applied last year and they still haven't been granted their visas yet. So definitely, Australia has been struggling to cope up with COVID-19 since the beginning. But it definitely did make the admission process very difficult for students, because at the same time, while they were trying to, get through their queries, calling the student center, they weren't able to reach out to the student center because there were no people. Everything was closed down, and it did make them a lot more anxious than usual. Made
Yeah.
it not only difficult for them but also emotionally and mentally stressful.
Yeah, I can understand. Well, it's different in different countries, of course. Well, for us in Hungary, I mean, for me as a Russian citizen, it was a long period to get the resident permit and visa. But I know that, for example, for like people from South America, it was easier. Still political questions, yeah. So, but also I have a question. Some students, I don't know how it was in your countries, but this year, 2000, okay, the end of 2020 and the beginning of 2021, we were online. So, and some of the students, they are like not sure if they should go to abroad to study there or stay home and study online, because it's much safer to stay home, and of course it saves you money. What do you think about it? How was it? Were you studying online or?
All right, right now, for students who are, for example, not vaccinated in Germany, usually university provides the opportunity to take online classes. In, for example, Technical University Munich, most of the classes are currently online, but you can attend. Like, it's not a requirement, it's not necessary to attend, but you can attend. And usually out of, for example, 200 people who are usually listen to the lecture, there's only 30 people, because they usually provide the lecture, like the recording or just the presentation, the PowerPoint after. But for my degree, which is medical student, naturally the online studying, online education is not very, like, it's not compatible at all. Yeah, not efficient. Which is why my classes are as much as possible offline. Still, not all of them are online, but I suppose that the university always provides the testing, the antigen tests. It provides the free ones for students, and you can get the vaccination at the university, so, and the booster as well. So usually university provides every possible opportunity for you to study as much as efficient as possible.
Yeah. How about Belgium? Galina, how's the situation in Belgium?
Yeah, from September we began to study offline, and only one lecture where there were more than like 100 participants. It became offline in January. Oh no, sorry, in December. But now we already starting to go offline again. So, but the only thing that everyone should be with masks during the studying. But I also heard that in other universities in Belgium, there are hybrid education systems. So if you want, you can go offline. If you want, you can participate online. Yeah, but I would say the situation is rather calm, because mostly everything is open, and the restrictions are not that strict.
Mhm. And how did the process of going home change since this? Especially, I'm interested in people who were living abroad for a long time, Daniel, Jacqueline, and Zlata in UK. So, like before coronavirus, you could go home whenever you want. Did it really change during the COVID? I mean, of course, did you feel it? Like, was it a problem, challenge for you?
Hi,
I
Julia.
can say
Yeah,
that,
please.
yeah, sorry. I mean, going from Russia to India, it was hard to go to India than coming back to Russia for me. Because while going, I had to take a test for the plane and then a test in the airport, then another test after 7 days. So when I came back to Russia, I'm not even a citizen in Russia. I just had to do one test for the plane. So yeah, going home was difficult, but coming back to Russia was pretty simple and straightforward for me.
Okay.
As for the UK, for me, it was extremely difficult. I've already graduated when the pandemic started and I was working full time. And sometimes I'll go to Russia for the weekend. So I'll fly on Friday evening, Saturday morning, and I'll get back Sunday evening and we'll go to work on Monday.
Oh.
And yeah, and with COVID, it was absolutely impossible because they introduced 2 weeks or 10 days quarantine for everyone. And at the work I was at the time, I should have been at the office. I couldn't work from home. So I would either need to take 2 weeks holidays just for quarantine to go to Russia, or to get unpaid leave, which was also impossible. So I've not traveled to Russia for 2 years. And yeah, I didn't see my family. It was difficult, but I finally went there in December for Christmas holidays. Again, I had to cut my holidays short for 10 days and come to the UK earlier and spend Christmas, New Year inside in quarantine, just to have this opportunity to travel to Russia. But in terms of entering Russia and the UK, you just need to have PCR tests. It was also stressful because all the regulations, they change all the time. And as a Russian citizen, I'm lucky I didn't have to do any PCR test when you go to Russia, but apparently you have to have QR code on Gosuslugi, and it's like very, very bureaucratic website.
I did a PCR test because Gosuslugi didn't accept I got Sputnik in Hungary. This is a Russian vaccine, but Russia does not accept Russian vaccine, which was done out of Russia.
my
So I
God.
had to do a PCR test.
Yes. And before traveling back to the UK, I've realized I needed PCR test. And I was already at the airport 2 hours before the flight, and I was panicking, looking where to make this PCR test, which is ready in the next 10 minutes. So yes, I would advise if you're traveling, just make sure you're absolutely clear on all the regulations and check them before your travel date, maybe 2 days in advance. So yes, that's my experience.
Good. Anyone else wants to share?
Can I go?
Sure.
Can I go?
Right.
I'm sorry, Daniel. If you want to go first, you can go first. Not a problem.
All right. I had some problems with traveling to back home, and I got to postpone my trip from January to August last year. And I had problems with the routes because I was supposed to take a direct flight, but I had to cut the flight like 2 or 3 times to be able to go to Brazil. And all the restrictions and vaccination and everything was hard. We had a hard time because I had a test with me, but because of the time related to my flight, I have to take a test inside of the airport, and it's another nightmare because I have to wait, and there's a lot of people trying to do the same thing. Everybody trying to travel, so you double your time, double your stress, and everything. But at the end of the day, I got it. But it was complicated because of all the restrictions. So you have to think twice and plan ahead of time to try to have the best route for you.
Okay, yeah. Find Shrika.
Yeah, so I think in that sense, Australia was actually the worst during the pandemic because they actually closed off their borders completely. And I was able to fly back to India because all the universities were online. There was no hybrid learning whatsoever. So it does get extremely stressful for you as an international student to stay in a country that you don't really know much about, especially amidst such circumstances. I was lucky enough to come back, but a lot of my friends were not able to come back to their home for 2 years exactly. And it was quite stressful for them. I mean, your family can't go to Australia, you cannot come back home. So it was extremely bad, but it's fine. It's all fine now. They've reopened the borders. And if you're planning to apply to Australia, I think now is the best time because they have reopened the borders and the testing requirements are actually absolutely minimal. And you just require a rapid antigen test as soon as you land at the airport and 24 hours before you take your flight. You just need that. Except for that, you don't really need any sort of testing, not even an RT-PCR test, which is quite gruesome at times. So now is actually the best time to apply for studying at Australian universities. But we are still waiting to hear back from the universities. They will give a verdict about the learning that they're going to continue on, the mode of learning. So we are hoping that they will switch to hybrid learning, which is offering both options, both remote for offshore students and in person for the people who are onshore. But we will hear from the universities in the next couple of days. So hopefully it'll be a good outcome.
Let's hope, yeah. Okay, great. And what were the restrictions in your countries? Because, for example, in Hungary, we even had a curfew around 8, and after 8 p.m., you were not able to go out at all. So what about your countries? Maybe.
I'll start. Currently, the restrictions are not that strict. There's no like you can go out after 8 or after 10. You can go out anytime, but the all the clubs are closed. You always have to have your QR code with you, and even when you're using a public transportation, you gotta follow the rule, which is 3G in German, which stands for get tested. So you had a testing, geimpft, so you had a vaccine, or genesen, so you were sick recently. And you got to follow this rule, and you can use an antigen test. You can make it anywhere for free. So these are all the rules. But usually the cafes or the bars or like restaurants and even universities right now ask you for a vaccine or a certificate of being sick recently.
Wow,
those are the restrictions.
I'm surprised to hear that you have a free antigen test. I remember when I got sick with COVID, I searched all the pharmacies and I was not able to buy it. So I had to go to the hospital, a private hospital, and do it. And in Hungary, it's extremely expensive. Guys,
yeah, fortunately, right now I can just go outside, go into apotheke, drugstore, do the testing, and I will get my results in like 10 minutes on my email, and I can use them for 24 hours.
Wow. What about US and UK? I'm very interested. Jacqueline?
Well, US, what I can say, for right now, everything's normal.
Do you wear the masks?
Yeah, I use, I was with COVID a couple of days ago. Not a couple of days ago, but yeah, because, I decided to fly after 2 years, after, such a long time that I couldn't fly. So I think that I got during my trip, because in domestic flights, you need to use a mask, but they're not asking you for any documentation that prove that you take the vaccines. Here it's Midwest. So Midwest is very open-minded, sometimes more than I would like. Danielle probably had the same experience, which is you need to use masks to enter places. Everything is open, works like without problem. But it's very common for you to see people without masks, or employees in bars and restaurants without masks. This is the scary part, in my opinion. But since the beginning of the pandemic, because I have rheumatoid arthritis, so I have a treatment, and my immunity system is low all the time. So since the beginning of the pandemic, I always use masks, and at the beginning I use gloves. Nowadays it's just mask. I avoid a lot to leave my house as much as I can. This is the reason that I didn't come back to Brazil for more than 2 years. But I will at some point. But yeah, depends on the country. United States, definitely the Midwest, they are very, like whatever. But it's the good thing is you can find vaccines easily. You can go to the pharmacy and get your vaccine. I got my 3 vaccines without problem. It's for free. You can get free masks in your university. You can get alcohol in gel. You can get free tests too. So this is the good part, because if you want to travel, you always can find a way that will be for free. You just need to plan accordingly, or otherwise, depends on the culture that you will go and their rules, you probably will pay on site, like Danielle did, because the type of test that you're taking, or the day that you took your test. So here we were basically living a normal life, I could say. Not for me, because I'm very skeptical about the whole situation. But yeah, and it's not bad at all. This is the reason I always recommend it. Like now, I think that if the student decided to come, will not be like the beginning of the pandemic, which you needed to, it's just online classes, you need to stay in your house. A lot of places were closed. Now you will have a normal life.
Absolutely agree. Yeah. Because the admission process is still easy, but there are no restrictions, so it's like perfect combination.
Yeah, what I can say about that is all the in-person process that are being removed to facilitate for everybody, because they still want the students to come and keep studying. So they're facilitating that. And like Jacqueline said, here in Ohio is pretty chill. Like you're like okay with the situation. In some places you have to use a mask, like downtown. If you're going downtown, or in a restaurant downtown or something like that, you have to use a mask. But if you're out of the area of the downtown area, you don't need to. But in the US, we have the problem that each state has their own restrictions. So if you go to Florida, they have something different. And if you go to New York, you have different restrictions. So you have to double check the place you're going to see which restrictions they have. But most of the time right now, you're fine. Like for me, I'm going to in-person classes because my degree is all hands-on. So we are going to class in person. We still have all restrictions, use masks, but we have to go. Like at some point you have to go, because you cannot take some classes online. You cannot take like anatomy or something practical online. There's no way.
That's true, yeah. And again, it's very different in different universities, and even within one country, within one city. In my city, I know universities who are online now, and we are not online. So yeah. What about Spain and Netherlands? Shreyas, tell us, how is it going now there? I mean, you're in Spain now, so.
Correct, but I do know a bit about both because I've been to the Netherlands recently. I went there on winter vacation. At the time I went, it was completely locked down, but now things are rather open again. It's changed rather quickly again, but yeah, what can you do? So in the Netherlands, they're going to go back to in-person education next week, I believe, officially for most things. I believe it's already available for the most part, but yeah, it's now officially getting together again. But my university is also taking into account that there are chances of people being infected and having to go into quarantine. Thus, online education is also an option, especially for classes with large amounts of students, because they can only have up to 75 people in a room. And of course, there are a lot of requirements for masks in the Netherlands as well at the moment. So, especially in indoor spaces. Spain, and then of course, yeah, things are generally speaking open in the Netherlands now, except for well, nightclubs and stuff. Spain though is totally open, actually, I would say. Just about everything, you can do just about everything actually. The only real restriction in Spain that I can tell, or that's really noticeable, is that you pretty much need a mask everywhere. You're even obliged to wear it on the street. But I mean, everything's open, and the main restriction that you'll find in both Spain and the Netherlands is that you'll need a QR code. And then I think in these countries it's with the 3G rule, which is you either need a test or a vaccine or to have healed from COVID. So that's how it is in these two countries at the moment.
It's interesting. It's very interesting. And how about the healthcare system in your countries, guys? I mean, have you experienced any situation when you need a medical help, and what can you tell about your country? Because you know, sometimes it can be very challenging, especially if you don't speak the language. How it was in my case, I don't speak Hungarian, so it was challenging. So maybe some of you can share your experience.
As for Germany, there is a special security, how do you call it? Sorry. You pay for
insurance, like you mean
insurance, right? I'm sorry. Exactly. So there is an insurance you have to have as a student. It's about 100 euros a month, and it covers all your bills, all your medical supplies. If you go to the doctor, you have the little card with your like insurance number. You show the insurance number, and everything that the doctor prescribes is for free. The maximal amount you pay is like 5 euros for a check. So I personally, there are many doctors who are international. For example, there are a load of Russian doctors, which you can choose. Like you can choose your doctor on normally. So I don't think you'll have any problems here if you get sick suddenly, or if you don't speak a language. There's definitely no problem at all here in Germany with that.
That's cool. How about Belgium?
Luckily, I didn't need any health help, but I agree with Sophia. It's actually same. Like if you have insurance, you normally don't have a big problems with it. But I can also say about Corona situation, there is a phone on which you can call, I think, anytime. And you can't imagine how much time did I call them, because I always had a problem with my certificates, just when I didn't know if I have to stay quarantine or not. And they always answer, they're always helpful. And also sometimes they speak Russian as well. So like if you have any question, you definitely will solve it, because they work really good. And there is also a center in the center of Brussels dedicated to Corona, where you can go also ask any questions or make a test, which normally you have to pay for tests around like 30 euro. But for example, after arriving to the country, the government sends you 2 codes with which you can do it for free. So yeah, I think that Corona health situation is quite good here.
Okay. Priya, how about the UK? How is the situation there?
Right. I'm sorry, I was too engrossed in the chat. I was still talking about the health issues. Right.
Yeah.
Sorry. So basically, when we get a student visa in the UK, we pay a part of money as a health surcharge, and that's usually for the duration of your course over here. So when I came as a student, it was £150 per year, but now it has increased a little bit, and it's gone to like 300 for students per year. So for example, if your course is for 1 year or 4 years, so 300 into the number of years that you're in the UK. So once you renew your visa, you'll again have to pay an extra health surcharge. So once you get that, you get a centralized number, and that's basically all the hospitals and everything have a record of you wherever you go within the country. So as soon as you come to the UK, within your radius, within like a 3-mile radius or something around your house, you go and get registered with a general physician, and you can go and get all your treatment, blood work, or anything free of cost. So you don't pay anything else. So however, if you want to buy some medicines that are prescribed to you by the GP, the general physician, you have to pay like a dedicated amount for that prescription, which is like roughly £9 per prescription. And the number of medicines on it doesn't matter. It could be 100 medicines or just one medicine. So you still end up paying like £9 for that. And all the surgeries, all the major things, everything are included in that. So sometimes the dental work and everything is not included. So if you have some dental problems, you have to pay for it yourself. Long-standing diseases like diabetes and things like that, you also have a concession on your medicines. So people having diabetic problems, they don't need to pay as much as like non-diabetic people. So yeah, that's pretty much it. And fortunately, I haven't had any serious health issues after coming here. Although getting an appointment can be a little bit fussy, because it takes a little bit of time to get an appointment, because since the health services are free for the local people, and the tax, it's from the taxpayers' money and the health surcharge that the international people pay in. So there's quite a long waiting time with the surgeries over here. So it can take a little bit of time. So for small minor ailments like a fever or something, it's better that you just take care of yourself, have a paracetamol and just stay indoors. But unless and until you have like a major ailment, then go to the thing. And yeah, all the blood work and all the other tests, physio, everything is included in the health surcharge. And I'm talking only about the international students that are coming here. If you become a resident here, it's just the taxpayers' money. So later on, things become much more easier.
Yeah, that's really nice, actually. And I'm really, really interested to hear about it from Caliban. How is it in Russia? I mean, from a view of foreigner.
Yeah, in Russia too, it's the same. Like every student should have their medical insurance. And mostly even the basic ones like cost from 5,000 to 7,000 rubles, or maybe 10,000. And it includes all the hospitalization charges and everything. And I didn't have to go to hospital during the COVID, but I had chickenpox, and I was hospitalized for a couple of weeks, and in an infectious hospital, and everything, including the medicine and the hospital charges, was taken care of by the insurance.
But how did you communicate with doctors? Do you speak Russian?
Few doctors, like the doctors spoke English, like they could understand to some extent, but yeah, the other people who work in the hospital when I was staying there, no, they don't speak English. But yeah, the doctors who come and check every day, they always spoke English with me.
That's
so yeah, it's similar like in most of the European countries, you pay the insurance and
yeah. It's quite similar everywhere. So, and are there any questions from our students from, yeah?
Let me add here. I saw a few questions about China in the chat, so I can just in general cover the topic. Yes. So China, ever since the pandemic started in 2020, in March of 2020, China closed the borders. And the students who were there, they are still stuck there. The students who were outside, who went home for holidays or something like that, they still could not come back, including me. So how does it work for right now? China has zero case policy. So usually there are no cases within the country, but sometimes some cases happen. It happens, we know that. But once there are at least a few cases in the city, China will get in lockdown. This one city, they would close it totally. And for like a few weeks, they can test everyone. Like my city had a lot of cases just like last month. So every 48 hours, they were testing everyone. A city of 10 million people. Everyone was tested every 48 hours. Yes. So your chance of getting corona is 0. But as of right now, I've been hearing a lot of news about some countries getting their students back to China. So there is actually a thing that even my university, they recently made this list of students who are coming back even like next month. But as of right now, it's really hard to get in.
Yeah, China has very specific restrictions, I would say.
I have classmates who studied with me. They were from China, like Chinese students, and they actually don't want to go to China because of, I mean, the flights are pretty costly even for them. And that's one reason. And they say that in here, it's pretty open compared to there. Like when this happens, like for example, Stacey was telling, right? When they see some few cases, they are going to shut down the whole city and they are going to test everyone. So because of that, since the pandemic started, even the Chinese students who are here, my friends, they don't want to go back to China.
Not exactly. I've had a few friends like Chinese who were studying in Europe or US, and they were going back and forth. And I was like, guys, I want to go too.
They have a lot of money, they can. Yeah, that's what my friends also told. The tickets cost like at least 5 to 6 times higher than the usual price.
Yes, it's both the prices plus the quarantine. You need to go through mandatory, I think 2 week in a hotel and then 1 or 2 weeks at home.
I also heard about it. A friend of mine went there for working offer. So, and he was like posting stories in Instagram, like first day in quarantine and so on. Yeah.
Even for, I think for Australia, they had very strict restrictions. I had an Australian friend. He was an Australian citizen and he couldn't go home for a year. Like he was waiting for the flight. There are flights and then it gets canceled. There are flights and then it gets canceled. So he was staying with his family for a year. And then finally he went back last February.
Okay, I see it's scaring. I don't want to scare any of you. So last year in 2020, in 2021, and even this year, each Chinese university is still accepting international students. How does it work? It's easier to get in, yes, for sure. And very often you can get in on a scholarship. So you don't have to pay any tuition fee. You don't have to pay dorm fee because you're not there, of course, or anything. So basically now the education is happening online, but this spring is very likely to be reopening the border. So it's very likely that by, for example, next year or next year, depending on when you are applying, you will be able to go to China. Don't be scared. A lot of people are studying online nowadays, but there are high chances that you can go back.
Well, yeah. So let's see how the situation will go. So are there any other questions from our students regarding this medical topic and regarding COVID topic, or maybe about university studying? And guys, maybe you can give some like advices, recommendations, how to deal with these challenges, because it can be very, very difficult. I mean, in a mental way, you know, and sometimes in the physical way as well. So what are your recommendations? How did you deal with these challenges?
I believe that you need a lot of patience, and keep in mind that now it's much better than the beginning. So you will hear stories all the time. Each person has a different experience. Definitely it's much better if you want to travel to study. And I believe that the universities are ready, at least my university, I can say, because they create a lot of things to facilitate your life. And I believe that from now on, most of the things, some of them will be online. So, you know, you just need to read everything careful. If you have any questions, contact directly your university. students can help you, but they're just students, they are not employees. So it's good to talk with their university to know what is going on, what I need to do, with to know about documentation. I will not say that will be the same way that was before. I think that because of the pandemic, things will change. I believe that universities are very open with changes, and people are basically living their lives without problem, but it will affect you somehow. It could be, hard, but keep in mind that now we are in a different moment of the pandemic. So I know that a lot of all my friends suffer a lot because it was their first year, everything online without socialization, but now it's different. Just, try to, StudyFree is here to help you out. It's definitely, I believe that I would like to have something like that to talk about the pandemic with students. But definitely use everything that StudyFree can provide for you, but talk with your university about the protocol, about what you need. And you will be fine. You will get your vaccine or your country or there, and you'll be fine. So don't worry about it, because things are little by little, normal again. So you can do everything. You can travel to you can explore United States, you can go to parties, you can just, follow the rules and it will be fine.
Thank you, Jacqueline. It was a very motivative speech. I really liked it, and I absolutely agree, actually, because life is going back to normal. Guys, who else wants to share their opinion?
In Moscow also, there were not very strict restrictions, I would say. At the start of the pandemic, some of the dormitories were quarantined for a long time, but only now, I think in November, there was restriction for 10 days. And then before that, there were restriction only during the summer for a couple of weeks. So during the restriction, what happens is they close the restaurants at 10. And even if you have but if you have QR code that you are vaccinated, that you can always go to any of these restaurants, but they close early. But other than that, life was pretty normal. You just have to wear masks in public transports and in malls, and when you go out. Other than that, I would say the groceries and everything, there were no problem with that whatsoever. So,
yeah. Okay. So we still have some time. If anyone wants to ask a question, you can unmute or type your question in the chat, and our mentors are ready to answer any of your questions. Don't lose this opportunity to ask your question. Okay,
I saw Vladimir was raising hands before, but he didn't ask.
Yes, I actually raised my hand. Sorry if I interrupted someone.
No, sure.
I actually have a question about Germany. Initially, my StudyFree manager said that if I'm taking my English course in German, I still need to know German language level C1 or B2. So that's why I'm learning it right now. But as I understand out of chat, so I've been learning it for 5 months, so it's a lot. But now I understand out of chat that I don't really need to do so hard.
Yeah, you don't have to. If you're studying in English, you don't need your German for university or for visum. You just show your English certificate. You really don't need your German, especially C1, which is like a very high level. This is a requirement for medicine and for engineering. It's not a requirement for English courses. You don't need your German if you're studying in English, not at all. Don't even think about that. Maybe your particular university has this as a requirement, then check on the website. In the website, they always say, you type, this in this university, this and this for international students. And they tell you all the requirements, right? And you just check the language proficiency, the certificate they want from you, and all of the languages.
Yeah,
Don't even
I totally,
worry.
I totally agree with Sophia, because C1 is like technical fluency, and technical fluency is too high standard for a beginner to learn. So as Sophia said, just go through your course requirements and the university requirements, and unless and until it's explicitly stated, you don't need the German proficiency. And once you end up in Germany, anywhere, the university, I think most of the universities offer free language courses that are free to get enrolled. And there are also multiple events where international people come together to learn German together in a fun way. You can do that. So you don't need to actually go through difficult classes right away now, unless and until your course requires it. Otherwise, you're all right.
Okay, thank you
I'd
so
say
much.
the best way, find a German girlfriend if possible, and you learn it in 1 month.
Wow, Zlata, good advice. Okay, so any other questions?
I think that advice is applicable for any language, right?
Yeah, agreed. Okay, I don't see any questions in the chat, but maybe I missed something. Please correct me if I'm wrong. Or maybe
Also would like to add, I just saw like the comment which says, in India, we prefer Russian universities to pursue courses like medicine as they are affordable. I would also maybe advise you to check the German universities too, because they are so much cheaper, and it's maybe 300 euros per semester, and the medicine is also really affordable there. So maybe if you're looking for affordability, then maybe check the Germany too as well in medicine department. Yeah.
And also we have a very good university in Hungary. It's in Debrecen, and a lot of people, even from Europe and from the whole world, they are coming there to get medical education. And I have some friends who are studying there for medical specializations, and I can say that it's really good, and you can find a job after this. But Russian universities are also good. So
yeah, I mean, for Russia, for medicine, no, my specialization was in engineering, but for medicine, there are a lot of seats in each university for with scholarship. Like, I mean, the full scholarship, and they also give stipend. So that is like, it's a competitive process, of course, the selection process, but still, there are tons of universities with a lot of scholarship portions for foreigners. So it happens like every year, and I see that a lot of students they prefer coming to Russia for this scholarships.
So there was a question, how many of you have already had a COVID? So I had COVID in Hungary when I was here in summer, and it went okay. And now we have a lot of cases. I know many of my colleagues got it, and many of my group mates. Yeah, so we have a lot of cases now. I don't know how it is in other countries.
There are a lot of cases in Germany right now too, but I've been here for about half a year and I never got COVID, although I'm not vaccinated, and I'm not yet. And I'm not like recovered, but I didn't get any COVID.
Even my teammates, like 3 of them got COVID in the past 2 weeks. So yeah, but I work mostly remote, so it's okay for me. I don't know. I think I had once. I didn't even want to test. Like all of my family had when I went to India, but yeah, it's okay.
Yeah, but I think.
Oh, sorry.
No.
I had COVID recently. I'm still recovering. It was my first time, so it was, like I was protecting myself a lot, and I say, you know what, I need to travel. So, but of course, that it's much better when you have all the vaccines. So I had 2 vaccines in the booster. So for me, and I was very worried in the beginning because I was doing chemotherapy and things like that, but actually was like fine. I had just 1 day of fever. I still have cough sometimes, but I'm pretty fine. So I mean, just for in case I'm in quarantine, kind of permanent quarantine because I want to be completely fine to
Yeah,
leave.
but I absolutely agree that after the vaccine, it's much easier. I also got my COVID after 2 doses of Sputnik, and it went very easy. And also, I got booster of Pfizer, and now I contacted some people, and after I knew that they are positive, and I didn't get anything, and I think that it's because of vaccine. So, and also I heard that Omicron is going much easier than it went before. Okay. Yes, it's correct. Hungary has a very good scholarship program. It's called Stipendium Hungaricum. So yeah, if you want, we can talk about it later, but I think we are a little bit out of time. So let's just summarize our meeting. It was very, very nice to talk with you guys, and thank you very much to our dear mentors for sharing their experience. So guys, what we wanted to tell you is that it's never the right time. Don't be afraid because of this situation. Do it now. Do it when you feel that you are ready to do it. And believe me, there are always some difficulties and challenges, but without these difficulties, it will be boring. With these challenges, it's much more interesting. So do it now and don't be afraid, and StudyFree, of course, will help you and assist with it. Thank you again to everyone. Thank you, and have a nice evening.
Thank you. Thank you.
Thank you.
Thank you.
Thank you very much.